So, 1 in every 8 American women will develop breast cancer in their lifetime, but mammograms drastically improve a woman's chance of surviving breast cancer. A mammogram is just an X-ray of your breast, and it detects and evaluates breast changes. And currently, women are encouraged to get their first mammogram at age 35 and get a mammogram every other year up until they turn 50. And once they turn 50, then they get a mammogram every year. But the federal government wants to change that and stop women from under the age of 50 from getting mammograms altogether. And once a woman turns 50, she can only get a mammogram every other year. So my proposition is that if women under the age of 50 stop getting mammograms, then the mortality rate for breast cancer will increase. And my reasoning for this is because women under the age of 50 will have less of a chance for surviving breast cancer if they happen to develop the disease. Second, women that are under the age of 50 and don't know that they're at risk, at a higher risk for developing breast cancer, won't have a chance of surviving if they happen to develop it. And third of all, women of all ages might just stop getting breast exams altogether. So for my first claim, that women under 50 will have a less chance of surviving breast cancer, well, first of all, mammograms are the best way to catch breast cancer in the early stages, which is critical for survival. Shaparak Kamari, a USC Associate Clinical Professor of International Medicine, said that breast x-rays or mammograms drastically improve a woman's chance of surviving the disease. He also goes on to say that a mammogram is the best tool available for finding breast cancer early before symptoms appear. Breast cancer can be asymptomatic for years. So say a woman is 35 years old and she happens to develop breast cancer, but she can't get a mammogram. Symptoms, they might not arise for a few years. So once she turns 50, if she happens to survive it or not have any symptoms of it, when she finds out that she has breast cancer, she might have a less chance of surviving because it's already been there for maybe a few years. It was predicted by Cancer.net that in 2009, 254,650 women would be diagnosed with breast cancer, and of those women, 17,825 were under the age of 50. So that 17,825 women would not have known that they had breast cancer if they weren't able to get screened. A personal example, my godmother was diagnosed with breast cancer 3 years ago when she was 41. And because she was able to get a mammogram, she was able to find her breast cancer early on, and she ended up beating it. According to ScienceDaily.com, compared to no screening, mammography screening every other year from age 50 to 69 achieves a median reduction in breast cancer mortality of 16.5% over a lifetime. If screening is started at age 40 versus 50 and performed every other year, there is a median mortality reduction of 19.5%. So despite the fact that there are negative impacts of getting a mammogram, such as false results and exposure to extra radiation, it does save lives. Second, women that don't know that they are at higher risk for developing breast cancer will have less of a chance of surviving it if they happen to develop the disease. So women that have blood relatives that have the disease are at higher risk for developing it. So if this policy goes into effect, then women that know that they're at a higher risk for developing it will be able to get screened every other year, even though they are under the age of 50. But if they don't know that they're at risk, then they still won't be able to get screened. So Cancer.org states that having one first-degree relative, a mother, sister, or daughter with breast cancer approximately doubles a woman's chance of developing breast cancer, and having 2 first-degree relatives increases her risk by 5-fold. So if a woman doesn't know that she's at risk, but she has 5 times more likely of a chance of developing it in her lifetime. Altogether, about 20 to 30% of women are at a higher risk for breast cancer because they have a relative that has it. So my third claim is that women of all ages might get scared to stop getting mammograms altogether. Since the government is using the risk of getting mammograms as reasoning for them to stop women under the age of 50 from getting mammograms, then women will probably just be thinking about the risk like their whole lives and just stop getting mammograms altogether. And so Judith A. Luce, who treats breast cancer patients at San Francisco General Hospital, says that people will end up not getting mammograms. They'll just kiss them off. I'm concerned the urgency to get them done will fade, because currently mammograms are the best way to get screened for breast cancer, and if women just don't get them altogether, then they will have less of a chance of surviving it if they do develop the disease, because they won't have early detection, which is critical. So, in conclusion, if women under the age of 50 stop getting mammograms, then the mortality rate from breast cancer will increase, because women under the age of 50 that develop breast cancer and won't be able to get screened will have less of a chance of surviving it, because they won't get the treatment they need early on. Second, women that don't know that they're at a higher risk for breast cancer won't be able to will not get tested for it, and they will have a less chance of surviving because they won't get the treatment that they need early on. And then third of all, women of all ages might get scared of it altogether.
All right, you've clearly stated what the claim is, and there's a good substructure that's easy to follow. Your labeling on the internal points is fine. I thought the citation of evidence was very solid through most of the presentation. The issue that I see as being problematic first is the notion that women are going to be prohibited from getting mammograms. I'm not sure that's how it works. It's mostly about a recommendation about when women should be getting mammograms, and I think the argument that most clearly applies to your point on that is the third one, that people might not see a value if the recommendation is not at an earlier age. They might not see a value of following through on that. I think that that's more clearly related. But the other points seem to be based on the assumption that women will not have access to mammograms, and I'm not sure how that works. It's not like the government is planning on prohibiting mammograms. There might be some issue about whether or not the government is going to pay for it if we have government-run health care, or there's some question about if that's the recommendation from the government, would insurance companies not pay for it, and then as a consequence, would women not be able to get access to these tests and procedures because they couldn't afford them. So there's got to be a little bit more explanation on those first 2 points. I thought the first point, you kind of explained what the benefit of the mammograms is at the particular age. I do think you need to go into a little bit of clarification as to what the relative values are and what the why the government recommendation is problematic. I think that needs to be developed a little bit more. The second point, I'm not sure how it's related because it's all really about women at risk, and if they're already at risk, whether or not they get the mammogram isn't going to change the risk factor. It's only going to change whether or not they get early treatment. And so we're back to the same issue that you have on the first point. And the third point, like I said, I think that's the one where there's a greater degree of causality if you explain what the policy is or what the issue is with the government recommendation, that could be a clearer argument. I thought you did a good job talking to the audience, and you had pretty solid vocal presentation. Sometimes you sound a little anxious and rushing, but for the most part I thought you came across sincere, and you've got a couple of points that you add in there to give yourself some credibility too. Thank you.